Hello. So I just wanted to update you on my current dilemma. So some of this is kind of going to be repeat, but basically my hemoglobin is dropping because I'm slowly hemorrhaging at my rectum. And so I'm in a bit of a time, like it's a bit of a race. My last ditch effort here is taking stool from my ostomy and putting it in my rectum. Because if it was divergent colitis, the thought is that that would theoretically clear that up. Nobody quite knows, and sometimes it's more than one thing going on. So I've done 2 implants, and it's at least not immediately obvious that it will work. But I'll keep at that for the next week or two or whatever, until I've made some determination if I'm headed in a positive direction. And then outside of that, it was suggested to do hyperbaric oxygen treatments maybe, but because I've done them a few times, if you have an acute respiratory problem, it's definitely very effective. But otherwise, it's kind of like a compounding effect, and it's not an immediate thing. So you have to, probably be a couple $1,000s invested to really know whether something would work. And the problem is it can't treat an underlying cause for me. Like it might alleviate inflammation, but I think I'd have to almost pretty well maintain that until I end up in a surgery, and it's pricey, and I don't even know if it's going to work. It's not as like potent as maybe some people might think it is. I have found it to be, like I said, with acute respiratory, it's kind of an exceptional situation. But I don't feel particularly bent towards trying that expensive invested option with, I guess, not a lot of, I don't have a ton of stock in it resolving this particular issue. So the surgeons won't do any surgeries on me until my liver is dealt with, right? Because the slow blood flow in my liver, impaired blood flow from injury that nobody knows what caused it, is back, it's causing back pressure and rerouting blood through my gastro tract and esophagus, which could hemorrhage. And because of the added risk from surgery on the circulatory system, surgeons just don't want to touch me till that's dealt with. So the shunt has to go in, which is rerouting blood, which means the byproduct of all the protein I eat, which creates ammonia, isn't being filtered as well. Whatever blood's going around the liver is not being filtered, which can cause encephalopathy. So that's a whole nother issue, but I don't think I can get away from doing it. So I'm going to do that. I'm waiting on them still. But in the meantime, I have to get the inflammation to stop in my rectum. I've been able to kind of slow it down. But don't seem to be able to actually get it to stop. So they want me on a biologic or a JAK inhibitor, so medical therapy, before, and to resolve all the inflammation before they'll hook it back up. The biologic is created from antibodies in a Chinese hamster ovary and then, quote, humanized. Some biologics seem to be made from embryonic cell lines, but my GI doesn't really think that that's true. But you can find that online, and I'm pretty sure it's something that happens more than we probably want to admit. And the humanizing of the Chinese hamster ovary antibodies, my internal specialist GI doctor decided to take it upon herself to research it with the manufacturers, which was extremely kind of her. But she ended up calling me a couple days ago and basically saying she can't get any information out of the manufacturers. So I don't really get the feeling that those are best practice drugs the way they're made. For me, who eats clean, and perceives my body as the temple of God, and the whole, like, ideology of profaning the temple. It's pretty bothersome to me, and because I didn't use them in like the heat of a battle and potentially could have easily died, it seems a little bit like demoralizing for me to kind of cave in now. It just feels sort of like a defeat or a compromise. But I do have a few people in my life that are saying, exceptions still prove the rule, and sometimes there's extenuating circumstances where you should just make those exceptions. So that's some counsel that I'm getting about the biologic. The JAK inhibitor is made clean, but it has much more of a cascade effect on your immune system. It's pretty high risk for shingles, which they want to vaccinate for, which I wouldn't vaccinate for because that's a live cell virus. Seems like it off of embryonic cell line. So I'd probably take my chances with shingles. But more importantly than that, they know it does cause respiratory infections, cardiovascular, like blood clots, and just blood clots altogether, deep vein thrombosis and so forth. And because when I have the shunt put in, the TIPS procedure in my liver, that predisposes you to blood clots in the shunt. And then the blood impairment in the small vessels of my liver seems like I'm going to be predisposed to blood clots. And nobody really has done any research, trials on somebody in my circumstance taking a JAK inhibitor. So it seems like a really risky drug to take, even though it's clean. So yeah, because of the risk factor, it almost made me I've been leaning towards just rectum removal, cutting the rectum out. And in that case, I'm guessing instead of just attaching me and rebuilding my abdominal wall in one blow, I'm guessing they would remove the rectum, let it heal, and then rebuild my abdominal wall with a revised stoma, which would mean I would be a permanent ostomate. I guess it would involve probably three total surgeries, including the liver rather than two. And as much as I would like to try to avoid the medical therapies, I don't know what complications will come from that, if any. I mean, I don't have to assume that there would be any. In terms of Crohn's, my chances would seem lower for recurrence, but even getting off the medical therapies, I would now have like a lifelong reliance on medical equipment, ostomy equipment. So there's that. Yeah. It's not really an easy decision. It's actually a hard decision. So I'm not really sure what I'm thinking to do, but for now I'm just hoping that the FMT works. And even though, like I said, it's not initially convincing, but who knows? So that's where I'm at, and we'll see how it goes. Okay, have a good day. Sorry, I just thought I'd tack on with the rectum removal. There are risks when you remove the rectum that's part of the structure of holding everything together down there. They know it can cause like fertility issues, which I'm not looking to have kids right now, but also impair urinary and sexual function. And those risks aren't low. Like I talked to a surgeon and she said they don't have like proper stats, but she said like, depending on the individual and what exactly they're looking at, it could be like from 25 to 60%. Like there's a lot of complications that can come from that. She recommended, this was a Vancouver surgeon, using up your medical therapy options before. doing that. Yeah. And then there's like, there can be pooling too, where you have to like get your menstrual cycle out with a catheter. And yeah, and then I guess you do pelvic floor therapy afterward. The other thing is the wound, they know it's a very hard, painful, and difficult surgery to heal. Some people don't heal, actually. They end up with an open wound like indefinitely for years. But I mean, I like to think that those things will all go well, but just thought I'd add that on for information's sake.